Charlie just saw his tag.
Don't throw it out. Good morning. We'll call the Human Services Committee to order for March 19th, 2026. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. You'll notice with disappointment that our Human Services Chair is not with us today, nor is our Vice Chair. So according to the new board rules and our parliamentarian, in the event of the absence of the Chair and the Vice Chair of the board runs the meeting. So I'm going to do my best to fill those big shoes that Jan fills so excellently. We don't have a quorum today either. So what we're going to do is we're going to work our way through this agenda. We're going to get everything on the record that you would intend to have on the record to make your requests. I'm talking to the department heads here. We're going to do everything except vote. And then we're going to have to come back in on Wednesday morning for a special. And hopefully the committee will have all the information they need at that point, in which case we can just quickly get our motions, seconds, and approvals. Won't take very long at all, won't make you guys repeat yourselves. The committee members that aren't here today will be able to refer to the minutes to get the information they need on your requests. So does that sound good? Okay, roll call, please.
Mrs. Burdick, Mrs. Ricketts-Wales, Mr. Barnes,
Present.
Mr. Curran, Mrs. Hanchett,
Here.
Mr. Stockin, Mr. Whitney,
Here.
and Mr. Harris.
I am here.
3 present, 4 absent, and we do not have a quorum.
Okay, without a quorum, we cannot approve the agenda. We're going to assume its accuracy. We cannot approve the minutes. We are thankful to be able to receive a monthly report from Anita Madison, Director of the Office for the Aging. We welcome you and thank you for coming.
Thank you for being here. So on the monthly report, I just have a couple of things to highlight, and then I have an update on our tax program that I'd like to share. On our monthly report, the things I'd like to highlight are PC Level 1 units. So that is our housekeeper chore units for the month. This is the month of January. We had 1,345 hours of in-home care. That is the housekeeper chore. The homemaker or personal care hours at 536.5 hours. And our case management hours are up from the previous month or the previous year at 189.5 hours of case management hours. Those are just a couple of highlights to start off the year. It is just the January monthly report. Is there any questions on the monthly report?
Any questions? And I see that you don't have any business for the committee today?
Not this month, nope.
Okay, well, sorry to make you come all the way down here for such a brief report, but we appreciate your time.
I love to share the information, so if I can share a little bit of information with you.
Please.
We do have our senior picnic date set, so I want to remind everybody our upcoming senior picnic is scheduled for Tuesday, August 4th, with an extreme weather date of Wednesday, August 5th. So registration is available if anybody is interested in getting registered for that picnic. You just give our office a call. That includes anyone who is willing to volunteer, all of our board and department heads. We welcome and enjoy everyone's help and appreciate everything.
We'll mark our calendars.
Thank you very much. Our senior tax program, which is called the TCE program, is currently operational. I wanted to share with you, I give updates every year for our tax program. Usually it's at the end of the tax program, but I wanted to give you an update now, even though we have a few more weeks worth of tax program operating. This year we had 616 tax appointments total. We have about 70 tax appointments left to be scheduled. We've completed 270 tax returns already. And as of 3/16, we have already brought back $360,495 back into older adults' pockets in Allegheny County. That is just straight refunds. That does not include any savings because there is no cost to having the taxes prepared through our tax volunteer program. That is straight refunds into pockets of older adults. That is all a volunteer program. So last year, we had 9 volunteers, and this year we have 13 tax volunteers. So I just wanted to highlight the great work that they do, and they continue to do for a few more weeks.
Thank you. Thanks for the reminder to file as well. Appreciate that.
That's all I had for the committee. Thank you.
Thank you. Okay, next up is Public Health Director Tyler Shaw. Welcome, sir.
Good morning. Just a few highlights on the monthly report. Towards the middle of the packet, you'll see our free rabies clinic poster in there. It will be at the Friendship Fire Hall, Saturday, April 25th from 9 to 12. We are trying to push everyone towards no walk-in, so if you can pre-register, that'll be open soon. If you don't have access to a computer, we're happy to register you by calling into the office. Just does keep everyone kind of moving through the clinic. We do serve on average 200 to 300 individuals, so we want to keep that line moving. At the back of that packet on the monthly report, you'll see our New York State tick analysis from various areas in the county. That's an annual report that we receive. I do want to remind everyone, and I do this every year, that this is just a snapshot in time, and it's only from these locations. That doesn't mean you won't encounter ticks in other areas of the county. This is just where they're doing their annual testing.
This is State Department of Health does field work.
Yes. And you'll see the infectivity rates on the various diseases. Borrelia burgdorferi is primarily Lyme disease. You'll see in that letter, too, this will be in the minutes, how that compares with the western region counties as well.
How do they catch them?
Drag. So they take a net. It's a white, it's not a net, it's almost like a drape cloth. They drag it behind them on the sides of the trails, and then they do usually 5 to 10 minutes, pull off the ticks, and they count them and send them in for testing.
Okay.
Questions on the monthly report?
Any questions? Okay, let's work our way through some of these requests. First on our list is acceptance of CYSHCNCAI funding.
Yes, lots of acronyms. So I'm looking to accept and appropriate. This stands for Children and Youth with Special Healthcare Needs, and CAI stands for Community Accessibility and Inclusion. We received some federal funds for a specific project, and this funding is going to help. You'll see later in the agenda with we have the actual Children and Youth with Special Healthcare Needs grant, and we have a project for this funding as well. So we received $31,252. $30,000 is going to go towards the project, and then we have some fringe and personnel in there as well.
Okay. Any questions on that one? Okay, I know the committee looks forward to approving that next week.
Excellent.
All right, Alfred University Facility Use Agreement.
Yes, this is for our children and youth with special health care needs. We have a summit every year, and this year we're going to do an educational summit, which brings together providers in the community, education, all types of service providers, and families to discuss children and youth with special health care needs.
Any questions on that one? Okay, Children and Youth with Special Health Care Needs Grant Contract.
Yep, this is just a renewal of our main children and youth with special health care needs grant, so nothing different.
Okay. Gretchen?
Is this the same amount? Is the funding flat or has it increased?
Funding's flat.
Okay. Thank you.
You're welcome.
Okay, contract with Eric Jones Studios.
Yes, so this goes with that CAI accept and appropriate. This is actually a contract for the actual build for this project. So what the project is going to entail, it's in your packet, is we're looking to do a sensory trail. We have not hammered down the exact location yet. We're still working. We have a lot of partners. Office of Planning is working with our office. We were working with the New York State Parks and Recreation office. We're working with the town of Canandaigua right now and Houghton University. So we're trying to find a nice location for a smaller, almost like a tree house, kind of fairy garden, and there's going to be a nice bench with some greenery as well. And it's all going to be hand-built, hand-carved. There's all built-in sensory items into the house, so there'll be tactile, there'll be sensory, there'll be different kind of elevations. So it'll be kind of cool.
Nice. Okay, any questions on that one? Sounds like a good one. Authorization to apply for Community Cancer Action Council mini grant.
Yes. So we were approached about either applying ourselves or working on a project for Community Cancer Action Council, just a small grant on either cardiovascular disease or cancer screenings. So right in our wheelhouse.
Everybody good? Student intern.
We got a student intern request from Keuka College. Student needs to complete a field period, which is a semester for them. It's unpaid, so free help for us. They get to rotate through the Department of Health and potentially recruit an individual after they graduate from school.
Good. Request to fill Director of Environmental Health.
Yes, so our director is leaving us, and we're looking to fill that position. That position is crucial to our operations.
You have a time frame on that?
She is leaving April 3rd, so we'll have a small amount of time where
Yeah.
we'll be picking up some work.
And that includes any subsequent backfills?
Yes.
Any questions there? That's bad news.
It is.
All right, request to fill Public Health Technician.
Also resignation, and we're looking to fill that one. This one really is doing a lot of our field work, doing some of our medium risk food inspections, doing our septic inspections, and water sampling for us as well.
Any questions on that? Okay, Tyler, all goes well. It'll be smooth sailing next Wednesday morning. We'll get all these through, and then those that need to come off the floor, we're prepared to get those off the floor on Wednesday afternoon.
Excellent.
Sound good?
Thank you.
All right, thank you. Commissioner of Social Services, Don Haran. Good morning, sir.
Good morning.
We just came back from Albany, and we got all the bad news that you've probably been aware of for many months. And now misery loves company, so we're all miserable together.
It's been tough.
Yeah.
It's been really tough. Lots of audits, lots of requested information, a lot of uncertainties on how things are going to be implemented with Medicaid. ABOD, as we all know, is fully implemented now. ABOD for Medicaid will start next year on the 1st. There's a new system that came in for Medicaid, where people will be transitioning off if they lose Medicaid or keep Medicaid. So we're really waiting for a lot of direction from the state on those.
Yeah, the early returns are that it doesn't matter how much outreach you provide in
Right.
terms of the changes in qualification and demonstrating, that you're fulfilling all the requirements. People, for whatever reason, are just not fulfilling those requirements, and so they're just automatically going to get kicked off.
Yep. And they're bumping up the recertification periods too. So, and that's going to be a big part of that.
Yeah.
So,
Okay, so we have your monthly report. Anything to highlight in particular?
Code Blue is in full swing. As you can see, there was 322 nights in January. We're housing on average anywhere from 10 to 12 people a night now. With the cold weather snap, a couple nights we had 18 to 20 people. Other than that, the monthly report is pretty consistent. If there's any other questions about that.
Any questions on the report? Okay, same process as with Mr. Shaw. We're going to work our way through these, and just with our apologies, we're not going to vote on them today.
Nope,
So you have a
that's fine.
request to fill Director of Temporary Assistance.
Yes, this is going to be due to a retirement. This is our top manager over the Temporary Assistance Unit, oversees Medicaid, Temporary Assistance, Supplemental Nutrition Assistance Program, employment, daycare, et cetera, et cetera. This person has been with the county, I'm going to guess, 38 years. There will be a lot of knowledge walking out the door when she retires at the end of April.
Okay. Any questions on that? All right, contract renewal with Hillside.
Yes, this is a preventive contract. This is a contract that we do every year with Hillside. This is mostly for the services unit. This contract covers a lot of advocacy for families who need it, for outreach to make sure that they're getting children to the doctor, their transportation needs are met, case management. They do a lot of family meetings and do a lot of family planning to meet goals so children don't get removed. And they do a lot of support if children like go stay with another family member under like a kin gap or a kinship placement.
Okay. Questions? Cat County Sheriff's Office.
Cattaraugus County Sheriff's Office, this is a contract that we do every year. This is for $30,000, same as last year. This is for the Child Advocacy Center. This is to help with investigations for cases that we get the Child Advocacy Center, and they also are part of our law enforcement advisory team and multidisciplinary team.
So this is county dollars paid to Cat County?
This is state dollars. We cover this with the stationary grant that we received from the Office of Children and Family Services.
Any questions on that? Amendment and budget modification with Accord.
Right. Okay, at the last meeting, the decision was made to do gap funding for $25,000. I went back, checked some regs, talked to Office of Children and Family Services, had a conversation with the county administrator, and Accord, and for the services that they are providing are the same services that I'm paying for with another funding stream that's 100%. This extra $25,000 we can claim as a general services expenditure. We won't get 100% money for it, but we can gain back $15,500. So to increase my contract and add this to it, the $25,000 won't be 100% local share.
Ms. Carroll?
Yes, so Mr. Horan and I had a conversation about this, and we determined that it would just be easier to amend the one contract rather than to do two separate contracts. It would be easier for his purposes of claiming and keeping track of the expenses, rather than trying to do two separate contracts.
So we appreciate you taking one for the team. The question is, are there services that you would otherwise provide with this funding that you've got to find, either not provide or find other funding for?
No, no.
And this is the contract that this is kind of piggybacking on is a one-year contract, so it's not a recurring expense.
Yes, so this is an annual contract. The non-domestic violence services is an annual contract that we do. So we're just adding this particular service to this agreement for this year. It does not necessarily have to be in the agreement next year when we renew the original agreement that we do on an annual basis.
Okay. I think it was the intent of the board for this to be a one-time. So if somebody can just make a mental note of that so it doesn't just slip its way into next year's contract, we would appreciate that. Not that we wouldn't fund it, but it would require further conversation. Any other questions on that? Thank you for doing that, Don. Appreciate that. Saved us some money.
Yep.
Renewal of agreement with the Allegheny County Sheriff's Office after hours.
Yes. This is something that we do every year. We're mandated to have a 24-hour answering service, and this runs right through 911, and this covers part of the cost for those calls.
Questions on that? Renewal for the DA's office fraud.
Yes. This is for fraud and abuse. We're mandated by the state to pursue those who defraud the department. And if they don't agree to the fraud that they've committed, we have this contract so the district attorney's office can make a decision whether or not to take that to court and then prosecute them that way for repayment.
So we contract with the DA's office.
Yes. It's something that would be 100% local share for them. But a long time ago, I had a conversation with one of our past district attorneys. This is not a mandated thing that they need to prosecute. So as long as it's not a mandated service that they need to prosecute, I can do a cooperative agreement so it's not 100% local share.
Okay. So it's state money that supports the effort?
Federal and state.
Questions? Okay. All right, another renewal, one more renewal, employment and training.
Yes. This is for our Welfare to Work program. When people come through the door, we hook them up over there to like complete applications or job training. They do a lot of outreach with local businesses to try to place people on the roads to self-sufficiency so they don't require benefits, and they're a key component of that.
Any questions? And finally, a contract with the University of Rochester Medical.
Yes. This is also for the Child Advocacy Center. Earlier this year, I did a contract with Dr. Coyne. Dr. Coyne has since then decided to retire. It's mandated that we have medical oversight over at the Child Advocacy Center. And we've been working with the University of Rochester. They also do other child advocacy centers for that medical oversight. The $30,000 is the same amount of the money that we had in for Dr. Coyne. And this is also reimbursed through New York State OCFS.
Okay. Everybody good on that one? Is that all you've got?
That's all I have.
Okay, we appreciate your time and thank you.
Thank you.
Unfinished business. New business. Good of the order. What time did this start? At 10:30. Tell Jan Burdick next time you saw her, you can run human services in 20 minutes. Motion to adjourn? Yeah, right. Barnes makes the motion. Seconded by legislator Hanchett. All in favor, say aye.